fertility and mental health. So really what your body and mind both need to hear. And I love this topic for personal and professional reasons, and we'll get into that, but we're really closing out Mental Health Awareness Month together with a topic that hits close to home for probably anyone who's joined us. Because preparing for a fertility journey isn't just about the protocols, the timelines, the appointments, and the medications, but as we all know, it's about managing the emotional weight of it all. So tonight we're really going to dig in with experts on what it means to be mentally and physically prepared for treatment, what to expect, what's normal to feel, and how to ask for support. We're going to start with some insights from my esteemed panelists, and we'll dive into a conversation. We'll make it juicy and fun, but we're really going to save time to open it up for Q&A from you. So as the idea hits you, feel free to put it in the chat, and we'll address that at the end. Okay, well, so just so you know who you're talking to, I'm Lauren Berson. I'm the founder and CEO of Conceive. We're a digital health platform supporting people on their path to parenthood with 24/7 access to nurses and peer coaches who are available around the clock and answer in under 5 minutes. We also have community supported, curated support groups based on where you're at in the journey, really kind of creating an end-to-end support. And I started this after my own multi-year journey to get pregnant, filled with heartbreak, confusion, and a lot of dead ends. So kind of really thought about what I wished I had and how we also can help support clinics. And that's why I'm so thrilled to be here with our partners at RMA of New York. So let me introduce Dr. Tanmoy Mukherjee, who is a board-certified gynecologist and reproductive endocrinologist and serves as the co-director of RMA of New York. He's also the associate director of the Mount Sinai Division of Reproductive Endocrinology. And in addition to his expertise in vitro fertilization, egg donation, and other assisted reproductive techniques, Dr. Mukherjee excels in a wide array of treatments for ovulatory issues, male factor, so important, by the way, we'll get to that at some point tonight, and management of inherited genetic diseases. So welcome, Dr. Mukherjee.
Thank you for that gracious introduction, Lauren.
Of course. And we also have Clara Leddy, a fertility nurse manager at RMA of New York, someone who is on the front lines of patient care, offering both clinical insight and compassionate support at every stage of the journey. Welcome, Clara.
Thank you so much. Good to be here.
Amazing. Okay, we've got a lot of folks trickling in. We're going to get into it. Let's start by naming the reality, okay? Fertility is physically demanding and exhausting, but it's equally emotionally exhausting. And these two experiences are deeply connected, right? You can't really have one without the other, and the best clinicians know that, which I'm lucky to be here with two of the best. So let's start with you, Dr. Mukherjee. I'd love to hear you talk a little bit about how you see the emotional strain show up in clinical care. Like, what's your perspective on the mind-body connection?
Well, I think that first we have to understand the setup here, because fertility is not something that people really think they will ever need. And coming to a fertility specialist office, when I was trained, they told us it was just like going to a cancer doctor, the last place on earth you really want to be. So I think, a lot of us do understand, how difficult the situation is, not only physically but emotionally, and we try. We want to be as scientific as possible, but we also understand that coming to these visits, being in the situation is not typical. So we want to get comfortable. We want to understand your story. We want to understand how our medical treatments can improve your outcomes and get you to that desired outcome. But we know it's a process. It's visits, it's testing, it's time out of your busy day. Think in a time where you didn't think you'd ever need our services. So it's a journey, and we want to start that journey by giving you our undivided attention, listening to your story. Then we're going to recommend some testing, trying to figure out what angles we need to do to explore to get you to that outcome. If you've had prior treatment, well, we want to go through it and see how we could do better so you can finally finish that fertility journey.
It's so important. And I really think so much of, now being on this side, and I was a patient myself, so much of the guidance by the doctors I sought out care from was strategic in that they were also understanding where I was emotionally, right? And I think that that's a lot of the secret sauce of how great clinics excel. Clara, talk a little bit about, you are fielding messages day in and day out, phone calls, patients who are in, the throes of loss, really struggling in all different ways. Like, what are the signals you look for to identify when someone might need more support, even if maybe they're not saying it to you. They're not saying, Clara, help me.
I think that a common question that I usually get from patients will be, have you seen anyone else in my circumstance have the desired outcome or in my age match group? So maybe they've like met with the doctor already, gotten maybe a poor prognosis. They want to be connected with people that have been in their situation before, learn tips and tricks, for doing injections and understanding how the process works. So even if they're not asking for that one-on-one help directly, that's one of the big things that I look for, that they're like, showing me that they're a little bit anxious about the process, dejected about having to be in this circumstance, and just looking for that extra, support from us.
Yes.
I think it's important. Clara brings a dimension to that new patient consult that is important, along with the medical side of things. We have support counselors, and now working with Conceive, we have additional therapy. But I think that one of the more important things to do is to let patients know how to access these services. When they come to our offices, we hand them the card, our email is there. And oftentimes, I follow up with a patient. They're like, well, how do I get a hold of this? And you have my phone, which is always available, the email, Clara's email. And in addition to our services, we have an IVF coordinator that's there to help guide you through the process. We have a financial team because let's be real. I mean, the medical part of this, the psychological part of this is important, but the finance part, invariably, I would say that a lot of the stress, and it rightfully so. Listen, I don't like paying. I'm afraid when I leave my dentist's office, what am I gonna, what am I do here?
Yeah.
Same here, and we try to answer those questions. And we have a financial team that's also dedicated to answering those questions. But I think a lot of patients need that information. They need to be prepared, they need to be equipped, and they need to understand what resources are available to them so that they can navigate this really, it's a complicated area medically, how they can navigate that successfully.
I think that's right. And I think it is such a delicate balance and really identifying the fact that it is so multifaceted. To your point, you can get stuck because you feel like crap, or you can get stuck because you literally can't afford it, or you can get stuck because you're not having success. And so having a team that's really well-rounded, and I think what you said really hits a chord with me, or strikes a chord with me, Dr. Mukherjee, on sort of knowing when you should reach out versus Clara versus Conceive, right? These are the things that we kind of talk a lot about, right? Because it's one thing to have a great support system, which is hard to find, but it goes a long way when, a patient hears from their doctor, right, on certain things and can help kind of unblock areas where they may be feeling stuck, even if they're not stuck medically, which is, something we talk a lot about. Um, and I'll just add from my own experience, there's obviously that clinical calendar, and if you're doing things like IVF or IUI or procedures or even diagnostics like HSGs and things getting ready for treatment, that's one thing. And then there's that emotional calendar, right? Like even the anxiety that someone might have over missing days of work because they have to show up for appointments and worry that their manager, excuse me, is going to count them out from the job, right? So you can be like in between cycles and still carrying like so much hope and fear and uncertainty. So I think that's why it's so important to talk about this out loud. So let's dig in a little bit more. Like, I mentioned earlier that, an RMA of New York is probably the first clinic I've spent time with that said this from the start, which is, our job is to identify the emotional piece as well as the sort of medical piece. So like walk me through maybe how you help patients recognize emotional red flags, whether it's like anxiety or decision fatigue, which is very real, or just feeling stuck. Like what do you watch out for?
Why don't you start, Clara? Then I'll jump in after that.
Yeah, I think patients a lot of the time, they don't even know where to begin with what they want. Like they're here for the guidance from us. And so I think we really need to tell them, based on X, Y, and Z, whatever the diagnosis is, this is our path and this is our recommendation. And then they can, say what they're comfortable with financially, emotionally, physically. And if that kind of, we bridge the gap and meet them in the same place. I think there will be barriers to treatment that are unfortunately out of people's control. Sometimes it is financial, sometimes it's, emotional, it's travel, it's their job, it's, a number of things. So it's taking what they're willing to do, physically able to do, and meeting us with medically what's, going to get them the best chance of success.
I think too that when you're entering in these waters, you complete all your testing. I think that it's an important visit with the physician. What I like to do is give people a path. Okay, so these are what your tests showed. This is where we're going to focus. What am I going to do? I'd like to try medication, maybe insemination for 3 or 4 cycles. If we're not getting anywhere by then we really need to sit down and talk about more aggressive measures. And I think that goes a long way towards alleviating a lot of anxiety. Where am I going? What am I doing? How long is this going to take me? What are my chances? And all of that gets folded in there. And I think when you lay out that, recipe, if you will, after you look at the ingredients with the testing and you lay out that recipe, I think people are more comfortable because, okay, I know this. It's not that much of a mystery to me anymore. This is what we'll do, and if that doesn't work, we'll talk about the next steps, and then our job is to explain to them why the next step may be more fruitful in terms of the outcomes they want.
Right. And it's taking something that can be very opaque because like as you said, right, this can be the first time for many that they're really integrated with our medical system, right? If you've been healthy enough until you go through infertility or even just approach your fertility, you may not have been enmeshed in our medical system. And so there is a desire for many, and not everyone, but for many to really understand like what's the map and where am I on the map and why didn't I go in that direction, right? Like why did you suggest I go here?
Lauren, it's that loss of control when you enter through these doors that we try to talk you back a little bit. No, you have control. These are the things that you can, we have things that we can control, things that we can't control. And
Yes.
if you find yourself with a diagnosis of infertility, well, you couldn't control that. But what you can control is talk about lifestyle. We talk about,
Yes.
activity level. We talk about supplements. We talk about, and what we want to do is not overwhelm. We want
Right.
to provide data, we want to provide resources. And I think that what we do well is we don't want the patients to define their lives through the lens of infertility. It's not that. It's a disease like anything else. It's like being
Yes.
a diabetic. You need to establish patterns, health, good habits, and we'll get through it. May not happen today, but put in the work and we'll do our best to get you there.
You have hit the nail on the head. I don't know if people are joining us from all over the country. I can speak for myself as a New Yorker. The loss of control, a self-proclaimed type A human who is used to, working hard and achieving things, right? And set myself up almost for failure with the notion that you could blink and get pregnant, which I maybe blame on high school sex ed, right? We avoid it for decades, or for me for decades. And then when I wanted to, I was like, well, now, why is it not happening now? And I think that's exactly what you guys do so well, right? It's helping center that patient and helping them get back to being a whole human. I know for myself, I talk about this really publicly. Like I lost myself for quite a bit there, right? And I obsessed over things and I over-indexed toward acting like I was pregnant for years before I ever was. And we talk a lot about that with our members and your patients of like getting back to being a whole human and not avoiding the things that you love. And maybe, on that note, maybe you guys can talk about, we probably have some of your patients here or some RMA New York patients. We may have some folks who, haven't shown up to the clinic yet. Maybe you guys can set the landscape a little bit. I love how you two work together. There's such a beautiful like symbiosis. Can you talk a little bit about how you work together as a team? How do you support patients that come in the door of your clinic?
So basically, the first step is doing the consult with Dr. Mukherjee. And then we have kind of two sectors that we go into. One is for the fertility care coordinator. So if a patient's interested in doing egg freezing or IVF, they'll meet with our coordinator, China, who kind of helps them walk through the process and give them a template for what to expect during the treatment. Then they'll meet with myself if it's more of a just fertility workup, just going into the diagnostics. So maybe like an HSG, day threes, like FSH, AMH workup, semen analysis for a partner if that's applicable. And then we kind of bridge the gap and do a follow-up with the doctor. So go over the testing. If there's any bilateral tubal blockages, any like polyps, fibroids that need to be addressed, low AMH, high FSH, things that we're, talking about doing more aggressive treatment early on, then, we'll discuss that. And kind of every step of the way, they're either in touch with myself, with the doctor, with the finance coordinator, with the FCC. So everyone kind of works together to build a plan.
Right, just to amplify on a couple of things. So the first session is about an hour. Uh, Usually takes a little bit less than that, but it's a review of your history. So just questions based on how long you've been trying to conceive. Have you been pregnant before? Are there significant medical, surgical, family history in some cases that may be important in figuring out what the diagnosis is? Uh, Reviewing lifestyle, just say, lay down, get an idea of what habits you have, making sure that you're eating properly, things that you can control, making sure that I believe in multivitamin supplements for men and for women when they're tackling this problem. And there's no pro fertility foods, but I just want to make sure you're eating properly and taking vitamin supplements. Moderate, some lifestyle behaviors. Caffeine, of course, moderate, don't eliminate unless you don't want to drink it. You don't have to drink it. Alcohol in moderation. Exercise too. I mean, we're in New York, exercise everything. I have patients coming in sweating, from running across the park to come and see me. I'm like, that's fine, but make sure that you're also eating properly and hydrating properly, and just look at their exercise history, look at their lifestyle history. So that's going to be the first hour. Then I'll do an exam. Usually I'll do an ultrasound to take a look at the ovaries and the uterus, and just to see if there's anything that's concerning. And then I'll bring them back into my office. I'll review the images of the ultrasound. I'll review their history, and then we'll talk about the basic fertility tests, as Clara alluded to. You want to look at egg quality. We want to look at anatomy. We want to look at sperm count. Genetics too is something that's coming into play these days, and that's the initial thing. And again, that seems overwhelming. So I break it down. I answer any questions, make sure that I'm not, moving along too quickly. And then Clara will sit with them and we'll outline the testing protocol. And then if they're here for IVF, if they're referred for IVF, then they're going to sit with my IVF coordinator, who's going to take a look at their testing and their checklist and their schedule, and then have them speak to finance. And again, finance is important. I want to keep going back to it because it is an important part of just putting patients at ease, knowing that they can negotiate this without, significant stress. We want to reduce stress as much as possible, and I do think that's an important part of it. So we want to inform, we want to follow up, we want to, if everything looks good, have them try on their own for a couple of months, treat as necessary, and then take it from there. But it's an hour-long process initially, then about a half-hour follow-up, either by Zoom or in person, and then treatment.
I think that's such a helpful overview. I mean, had I known any of those things when I was getting started, a lot of it can be contextual though, too, right? I may not have paid attention if I had heard about that. But now that you've elucidated like all of the different players, talk to me a little bit about like your relationship, Dr. Mukherjee, and how often you're going to see a patient and how, and not just that, I would say, like you have this robust team, right? You're always looking at the results and you're always making decisions, but like there's such a
Yeah.
sophisticated
So
interplay.
I think to answer that question, well, what is it that I do? I mean, I do sit in this office a lot, don't get me wrong,
You're doing
but
things there.
I'm seeing new patients. Then I have an operating day
Yeah.
where I'm downstairs and I'm doing the egg retrievals and then I'm doing the embryo transfers. I may have procedures to do up at the hospital where I have to go up to Mount Sinai and be in the operating rooms there. Not everybody operates as much, but usually, you're going to have some time where you need to do procedures. Then, okay, so I'm going to give you a medication. Well, I have to monitor your progress. So in addition to new patient days, I have to be in the office. So 7 o'clock in the morning, typically, so you can get here and then you can get to work with as little disruption. It's going to be somewhat disruptive, but we want to minimize it by opening before you need to get to work. So I have to be in the office doing ultrasounds, seeing patients in that morning monitoring period, which now is about 7 to 10 o'clock. So I do that a couple of days a week. So I'm seeing new patients, I'm monitoring in the morning. I've got the OR here, maybe OR at Sinai. So those are the things that I have to do. So how often are you going to see me? Well, clearly you're going to see me at the new patient visit, whether it's remotely or in the office. Then I have scheduled days. I can't be here 5 days a week because I have these other commitments. So let's say we're open 7 days a week. This office is open 7 days a week, 364 days a year, because when you're ready, we need to be ready and we need to monitor your progress.
Yeah.
So during the week, every Tuesday and Friday, as Clara will attest to, I'm here monitoring patients. I also see patients that day. Mondays I can't because I'm in the OR. Wednesdays I can't because I might be up at Mount Sinai. And then, Thursdays I'm usually seeing patients, but I'm not monitoring. So that's where I am. Wherever I am, you can email me and I will get back to you by the end of the day. Wherever I am, Clara knows where I am, and Clara's a very, exactly. Without Clara, I probably wouldn't know where I need to go. So, she fills that in. So when are the patients going to see me? 2 out of the 5 days during the week, they're going to see me for morning monitoring. The weekends, I'm here, like there's a group of physicians, and clearly we're not here every weekend, but we have weekend rotation. So you may see me on the weekends doing procedures. But
You're always reviewing results.
we are always reviewing results.
Exactly.
Every day in the morning, you will have, if you're in for the more complicated treatments like IVF, you're going to get a blood test and you're going to get an ultrasound. Those I look at every day because they're on my computer, and regardless of where I am, if I'm in the OR, I can see it. If I'm at Sinai, I can pull it up. So I'm always on top of those results. And, Clara, of course, is keeping in touch with me with email and text saying, listen, you got to look at this, you got to look at that.
Yeah.
So, your results are being reviewed by your physician, not just me. Forget me. The other physicians in the practice are looking at their results, and they're looking to their patients, because who knows your patient better than the doctor you came to see? Now, you may not always see them in the morning, but they look into the system. They're going to see your ultrasounds. They're going to see your blood tests, and they know your case better than anybody around, and they'll, with their nurse and their team, figure out the next steps for you.
I think it's so important just because it's a different dynamic than maybe any other doctor that they've seen before in their life, their primary care physician or their OB, right? And so I think that education is so key, and you are always there, you as the doctor, kind of helping make those decisions and creating protocols. Let's shift a little bit to talk about one thing that I find that's really important, but really hard, is asking for help. Asking for help is not a failure, right? And seeking out support is not a failure. I know from my own experience, I was, of course, I felt like I was completely alone in my journey. I was sandwiched between tons of friends who had babies in their 20s and then tons of single friends. So it was like, of course, no one's going to get it. I was very wrong. The moment I started talking, because I'm just not one to keep quiet, it was kind of like the floodgates opened. I heard from friends and strangers and people I hadn't spoken to in decades reaching out and saying, like, hey, your story sounds like mine. Can we talk about this? And what happens is we're forced to form sort of underground networks of those who are suffering in silence. And this is back in 2017, 2018. So I'm aging and dating myself. I think things have certainly shifted, right? There's a lot more people kind of on social media talking about these journeys. We're having these important conversations out loud. But I think what's really critical is sort of sometimes we don't know that we need that level of support, whether we need a coach or a therapist or a doctor or a nurse. Each person plays a different role, and you guys are there to support patients. One thing I found very surprising was very universal early on when I pulled together kind of an early proof of concept for Conceive was there was a little bit of this fear of like asking your doctor questions. Like, can I bother them? Talk to me about that. Like, how do you, how do you foster that environment where, and I actually don't think it's anything a doctor does. I think it's just this innate thing where we get nervous once it's the white coat syndrome, right? Once we see the lab coat, like, what do we do?
I take this off. I'm like,
Yeah, just take it off. But you've solved it. You've solved it.
It's comfortable.
But it's so critical to ask for help, and it's something that we just encourage patients again and again. I don't know if you have any comments or thoughts on that, but it's something unique for this, I think.
Yeah, I think that is very common that people, I don't know if it's the doctor is the authority figure, and so they get nervous to ask questions or thinking asking questions means they're not compliant.
Yeah.
Whatever reason it is. I think
Right.
patients tend to get very comfortable with the nurse.
Yes.
Myself, I'm in contact with a patient 5 to 10 times throughout their cycle. They get very used to me. They think of me as like their confidant and someone that they can always talk to. And of course, like I will always be that person for them, but I do know when I think it's gotten to a point that they do need to speak to their doctor, where I think like maybe they've lost touch a little bit,
You're
to try
that
to just
connected.
bridge the gap and say like, hey, I think this person might be struggling a bit. Could you just do a quick check-in with them, like give them a call this afternoon? And that's like how we're in touch every single day. So just having, those open conversations with patients is helpful.
I love that. I think that's so important. And I know this is my trying to elucidate like how people can reach out to their team, right? While we shift a little bit, I want to remind everyone that if you're here, we're talking about holistic care through fertility, so the emotional and the clinical. If you have questions, feel free to pop them into the chat. We will address them at the end. So I want to make sure everyone knows that. Okay, let's talk a little bit about Some of the harder moments, you know, those in between moments, those 2 week waits, the time between cycles, waiting for test results, the night before a transfer. Um, Clara, maybe we'll start with you. Like, what do you see working for patients to help them stay grounded and feel like safe, I guess, during those stretches of time?
Yeah, I mean, to be fair to patients, we do give them a laundry list of things they can't do. So I think that does breed a little bit of anxiety, things that would help de-stress. So we're like, no alcohol, no intercourse, no high impact exercise, all these things that like maybe you would imbibe in, if you were in a stressful situation. So I think finding things that are, grounding, but also like healthy, cooking, meditating, reading, like, find a hobby that can be distracting, avoid obsessively Googling symptoms. Like, we've talked about a very common thing patients will say is, I feel nothing. That means the cycle didn't work. And, always remind patients that like we're testing extremely early. We're, catching you like right as a pregnancy is forming, and a lack of symptoms is not a bad sign. So just like giving them reassurance and reminding them that they're doing everything right.
Well,
Yeah.
I will clarify that a little bit. I don't tell patients they can't drink. Social alcohol is okay.
Well,
5 to 6.
2 week wait, like after a transfer.
I,
After transfer,
yeah,
I say no to drinking after transfer.
five to
New
six drinks
guidance is
per
being revealed.
5 to 6 drinks per week.
No one's gonna drink after their transfer.
I thought you were going to say per night, and I was like, okay, well,
Wow, wow.
Just a
I want to
couple.
party with you. No, no, 5 to 6 per week. No more than 2 servings in a given night. So you want to a glass of wine with dinner. And
totally.
until you have a positive pregnancy test in my book, it's fine.
Yeah.
I mean, listen,
Well, anyway, but
I love that. I'm just going to say,
now we're arguing.
I just think Clara may jump in after me, but I like just when I think about how long it can take, and it can take a year, and that could be normal depending on your age, right?
Right.
Um, the acting like you're pregnant before you're pregnant, that's what became kind of the hardest for me, as I was saying, again, just speaking from my own experience, but also from our thousands of patients that we've had, especially the sort of New York patients. Again, I'm emphasizing we're similar, where you are restricting your life so much that you lose a lot of yourself to it, right? And so I think that guidance is really key.
Right. It's difficult enough, and we're asking you to change a lot of things. And unfortunately, again, when you view your entire life through the fertility treatment process, you lose yourself. You're losing one of the most powerful tools you have at your disposal by losing yourself to this process. That's a hard balance, and you can tell. You can tell when patients are withdrawn or they're hopeless, or you can. That's why our clinic, which I love, we monitor in the morning. Like I said, we're not here every day, but I'm here twice a week, Tuesdays and Fridays. And Clara sees a patient and they need to be seen by me. Well, they're going to come on a Tuesday and a Friday, or if it's later in the day, we'll accommodate. But usually, being here twice a week is enough time for patients to, if I to see them and talk to them in the morning, and show the ultrasound with them and let them know where their cycle's going, how they're responding. all,
Yeah.
all of that all of that needs to be done, and you need a good team on top of that to make sure that information gets transmitted. Now, sometimes we're not 100% successful. Nobody's 100% successful, but we do our best at that. We try.
Interestingly, our top two articles, we have articles for members only, and then we have some that anyone can find through search. And the ones that are kind of publicly available are, can I drink while trying to conceive, or is it my period, or am I pregnant? Because these are the two things where it's that lack of control, and it's like trying to figure out, yeah, how to stay on. And I think one of the things we do when you're a member of Conceive is really, again, what you're saying, Dr. Mukherjee, I think is like playing into the psyche of the patient. Like you're recognizing when they are really down, right? And when they may need a little bit more freedom to be themselves, right? And that I think is the key thing. And one of the insights that led me to start the company, which is like, how could you enable personalization at scale? Because as you said, Clara, like people are Googling and ChatGPTing their way through hell, to be honest. And the reality is what you're going to find on there is not going to be an answer for Clara. It's going to be an answer for, just the least common denominator. And so I think that level of personalization is just so important. So not a question there, but more a comment. Are there any other, like, as we kind of close out this section, and again, if you've got a question, feel free to pop it in the chat. Don't be shy. Oh, we've got a couple questions. Great. We're doing great, guys. And you can ask anonymously if you do not want to put your name to it. So great. We will get to those. Maybe like, when we go through these tough moments, I had, I don't know, what felt like a million 2-week waits. We sometimes make it harder on ourselves, I think, because we're comparing ourselves to some incomparable metric, whether it's like the Instagram influencer or the best friend forever who blinked and got pregnant. Um, I know that, when I was going through it and had a loss after a year and a half, I didn't really feel like I had anyone who got it. So like, are there any tools or tips that you advise as far as social media or boundary setting? Like how far do you guys go there?
Well, listen, I mean, I think it's a reality that all of our patients, we understand that they're going to go on social media, or they're going to go online. I'm going to give them an AMH number. This is your AMH value. I know they're going to go home
Yeah.
and put that into Google and see what it means. I know that. And I try to head that off at the pass. But,
Yes,
we have to exist in that information environment. I think it'd be naive for either one of us to tell somebody, hey, don't go online, don't listen to social media. That's kind of
of
ridiculous.
course.
What you want to do is give them access to your viewpoint as well. This is what I think. This is what I think is in your care. This is how you should proceed, right? And they're welcome to go online and then I read this and they can email me those questions and we answer those questions. That's our job. Nowadays, it's every physician, every nurse's job. I mean, that's what we do.
Yeah.
Um, so as far you have to be careful. You have to be a critical consumer of medical information online because
Yeah.
a couple of things, as far as unfortunate miscarriages go or fertility goes, fertility is very personal. Nobody's going to open with, "Hey, I just did Clomid," or that. Nobody talks about that. It's censored data. For example, a loss, a miscarriage. You get together with friends and family. Everybody's going to open up with that successful pregnancy. It's human nature. They're going to tell you about that. Nobody's going to launch into discussion. Oh, I just had a loss at 8 weeks or 7 weeks. But the important thing to keep in mind, it's far more common than you realize. It's just simply people don't talk about it.
Got it.
For obvious reasons, I think. I don't think that people want other people to know about their medical conditions, the difficulties that they have. I think that that's just natural. However, once you're in these territories, if you will, you're surprised by how much support is out there because there are a lot of other people, unbeknownst to you, who have gone down that road. You don't have to reinvent the wheel. People have been there and they've done that. And I think part of our job is also to share those anonymously, of course, because of confidentiality. But we've
Yeah.
been on a lot of these journeys with a lot of couples, so we kind of know.
Yeah, and I think what you're saying is so important in this digital age where a lot of people get information from TikTok, right? And I think what is so key is being able to cut through that noise, right? And recognizing, I think, and I think a lot of your patients probably do, is like just because it worked for this person doesn't mean it worked for me. I mean, that was what I always felt, right? I'm 42, I live in New York. It doesn't mean the 40-year-old down the block's advice will be helpful for me, or even the 22-year-old across the country, right? And so, how do you really get the curated advice, the personalized advice that's right for you?
Well,
And
that's why Conceive is important. Like you said, there's a lot of information out there. So by growing a valid, reliable source of information is in everybody's interest for all the fertility patients out there, knowing where to look.
exactly. I'm proud that 88% of our members say they avoided a call to their clinic and Dr. Googling because they had conceived. So
I
we
think they're just telling you that.
fine.
Combination.
Yeah.
Okay, let's talk a little bit about like support network. So, Dr. Mukherjee, Clara, tell me, either one of you can start this one off from a medical standpoint. Like, how does emotional support factor into outcomes, if at all? What's your point of view there?
I think a lot of patients really like beat themselves up when there's a failed cycle or a bad outcome. And so it's just about reminding them that, again, we're monitoring them every step of the way. We're doing their blood, we're doing their ultrasound, we're confirming that they're doing their medications correctly. And a lot of the times it is just a matter of like finding that lucky egg or, having a good cycle and reminding patients that they are doing everything right. I think that's, why things like Conceive are helpful is that people really seek out stories that, you know, help them remind them of what they're going through and that people do have successful outcomes. And, put people in touch with someone who gets it. Like I have a lot of patients who say like, I talk to my parents or I talk to my siblings, they're like, why can't you just get pregnant the old fashioned way? Or make, these offhand comments that, because they don't understand the process, but it can, minimize somebody's diagnosis. It can make them feel more isolated. So, us being there to be helpful to them and say, I understand you, I understand what you're going through. We want to help you through this process as much as possible. I think it means a lot to them.
That is so real. That rings so true to me. I mean, in addition to us having nurses who are there to reinforce like your care, right? If they're a patient of the two of you, we also have our coaches who've been in the shoes of the patient and have that like deep empathy and compassion. And they do things like help you set boundaries with nosy mothers-in-law who keep asking when you're going to have the baby, right? Or, how to talk to your partner about supporting you better through it, because I do think so much of it is that. And you talked earlier, Clara, about recognizing almost like the emotional red flags when people start asking for like, did anyone else have this or does anyone else have that, right? Like, are
Mhm.
there any maybe real stories or patient examples that come to mind that you want to share anonymously, of course?
Yeah, trying to think specifically. I think a lot of them, usually with like a genetic diagnosis, so like an inheritable genetic disease, so someone who's like kind of bound by IVF and doesn't have the option to kind of get pregnant on their own, those patients tend to ask for other success stories or ask for more statistics, I think. Also like severe male factor cases who also wouldn't have the option to get pregnant. I think especially for the male partners, they tend to know even less about this process. So they get really anxious about sperm counts and, want to know everything that they can do possible. And I'm in touch with those patients a lot. So it's kind of everyone.
Yeah, I mean, what we want to do, we don't want to assign blame with couples. They're part of the solution. We're all on the same team, right? This is what it is, and we'll figure it out together. I think that offering specific support medically, for male factor cases, we have a wonderful urologist that we refer cases to. We have a wonderful nutritionist because we have patients coming in here. And it's like, doctor, I'm trying to lose weight. I feel like that's the reason that I'm not succeeding. Well, listen, nowadays, more so than ever, there are successful options for you.
Yes.
There are situations where couples, despite our best efforts, do start to get acrimonious, and they
Yes.
like my husband smokes. He's not just cigars on the weekend, but he's smoking marijuana. He's not stopping, and it gets very testy. Rightfully so in some cases. So, in addition to our there, we have therapists that can discuss this because maybe it's a marker or something else. Maybe this anger that they're feeling is not just because they're having difficulty conceiving. I mean,
Just adding to the stress.
it just adds to the stress, and there's other things in the relationship that are not being addressed that probably should be addressed that we need to, maybe not flesh out in front of everybody, but privately taken aside and said, okay, what's going on here? So there's a lot of things that, this is an interesting disease. There's not very many issues where there's, multiple parties that are involved, and you have to kind of manage a lot of different expectations on a lot of different axes. So, yeah.
It's so interesting you say that and so important. I think the notion also that it really is kind of 50-50 in a way. That's the rough thing, right? It's a third male factor, a third female, and a third we don't know, which is
Unexplained.
yeah, unexplained. When I think for so long the brunt of it was often put on women, and women are often the ones navigating the healthcare journey. So it kind of perpetuates this notion that like it is a women's health issue, when in reality, like I often say, it should be the first thing that you do if you have a male partner, get a semen analysis. It's cheap, easy, and pleasurable.
It's
And you can get some insight. I wish we could ejaculate eggs. We would know a lot more about our fertility. And anyway, there are lifestyle changes that you can make, right, if there is a male factor component. But I think what you hit on is really key, which is to say that it takes two. And so what's difficult, I think, sometimes is women maybe kind of at the center of the journey And then they almost have to, maybe if they have a male partner or even a female partner, sell their partner on the other thing. It's like, hey, you need to do this. And it's like, wait, what? Why do I need to do that? And it gets tricky. I mean, we've seen that play out a lot. I'll just say from experience, I have a phenomenally supportive husband. This is not a knock on him at all, but I think when we went through our miscarriage, it was just difficult in the way that we process loss, right? We just process it differently. And he was sort of ready to keep going, and I was really mourning. And so I think that's a lot of what we try and help with. And of course, refer out to therapists. There's amazing therapists. You guys work with phenomenal ones here in New York, because sometimes that is, to your point, the first time that that stuff is coming up, and it's maybe not about the fertility journey, but it's, yeah, it needs to be addressed.
Yes.
Um, okay, phenomenal. So, I think one thing I'll just maybe put a fine point on this part with is, like, not feeling alone in this is a good thing, right? We've talked a lot about balance today. We've talked about, like, don't overdo the workout or the diet or the supplements, right? Like, and also try and seek out some support that works for you, right? For anyone, getting some support just can feel transformative. We hear members say every day, I don't feel so alone anymore. Because again, it kind of feels like we don't walk around with stamps on our heads saying, like, I'm going through infertility, or I've been there, or I have a similar journey. And it's like hard to know. Even my closest friends had stories they hadn't told me for years because they just didn't think it was relevant, and it wasn't safe for them to share it with someone who is maybe single or experiencing other things. So I think that level of care, that level of matching with people who get it is so critical. Before we kind of open it up to the audience questions, and I think we have about 5 or 6 questions in here. Any last thoughts for anyone navigating fertility, on sort of the mind and body?
Right. I'll let Clara speak. I don't want to jump in here, but I think that one of the things that's really off-putting to patients, and we've heard this consistently. I mean, you're in New York, you have some great programs. You have our program, which of course I think is the best, but you have Cornell, you have NYU. But I think some of the features of these programs is they're busy.
Yeah.
They're busy because they're successful. They're good at what they do, and they try to deliver care to as many couples as they can. I think that you have to have a good physician, you have to have attentive nurses, you have to have a good team. You also have to have a little bit of patience to understand how each practice works in their own way, how you need to control the lever. I mean, it's like you got to understand the game and how you can get to what you need. And I think from my point of view, I tell my kids, oh, my patients email me, and they look at my head, email. I'm like, well, it's what I got, right? So they can email me, they can call, everybody on the team. There's a team email for all the doctors here. There's a team email, it's a personal email. Nurses have emails. Our finance people have emails. So we encourage everybody, email everybody. I tried reaching Dr. Mukherjee 3 times today, and he hasn't gotten back to me. Then Clara will come knock on my door, or somebody will come and say, "What are you doing?" And I'm like, "I'm getting there," and ultimately we will sort it out. But patience is also kind of important with this whole thing, because these practices are big, but they're successful and they get results.
Yeah, I think one thing too that patients always mention is how, like, fertility clinics, not just RMA, but anywhere, is like feels like a factory. And so I think it's important to remember there is like an element of this like assembly line thing going on where you come in and you do your blood, you do your scan, you wait for a call, come back in 2 days, you do it again. And so kind of like preparing yourself and understanding that that is part of the process, that there are multiple people involved in your care. You'll meet with a phlebotomist, a nurse, the doctor, the embryologist will take over and create the embryos. Then we send out to a third party lab. There's a lot of people involved in the process and the care. And again, like Dr. Mukherjee said, patience is key. It's just kind of a waiting game, and everyone's very anxious to get to that end goal. But, understanding that it's part of the process will help, rein in that control aspect that everyone gets
Yeah.
caught up in.
Yes, I love that. We do that a lot too, is we will help set expectations when someone says, "Hey, I asked this question and I haven't heard back." Like, when you are an RMA of New York patient, you get Conceive at no extra cost to you, and we act as an extension of your team to be able to offload some of that stuff that doesn't necessarily need to go to them. So we'll help answer the question the way Clara or Dr. Mukherjee will. And when we can't, we try to do those warm transfers, or at least set expectations to say, this is when you can expect a response, because a lot of it is hurry up and wait and it can be anxiety producing. But I think it's really important. Like the care is there, the team is there, the best team in the business. So, okay. Let's open it up to some audience questions. Let's start with, would you suggest fertility? I'm going to hold myself back from trying to answer because I'm not a doctor, but I sometimes pretend like I am one. Let Dr. Mukherjee answer this. Would you suggest fertility treatments for a couple who's been trying to conceive for less than a year?
Treatment's not necessarily, but an evaluation. You should see a fertility doctor because I'm going to actually take that back. It depends on your age. I think if you're in your 30s, yeah, 6 months.
Yeah. Yeah. Awesome. Okay. Super helpful. Okay. And then let's talk about, we've got a 37-year-old female, underwent laparoscopic, excuse me, surgery in March, low AMH 0.1. This is a very specific case. Chances of natural surgery or IVF. How many cycles of IVF would I need?
Again, AMH is a very confusing statistic because if you look at the general population, even women with low AMHs get pregnant at the same rate as other women with normal AMH. So AMH itself is not the predictor. Age is an important predictor. Being
Yes.
under 40 is very helpful. What
Yes.
was the laparoscopy for? Is there a chance that you're going to need aggressive therapy? Yeah, probably, but I think that it's a tough question to answer. I think that you need to have a discussion with your fertility. You need to have a fertility care provider. Have a discussion with the fertility care provider about, well, how do I get pregnant now? And now the question is also for the next baby if you want another child. So you want to look at the whole picture. And with those little slices, the only thing that I could tell you for sure is that you should be seeing a fertility specialist. You should have a plan as to what the next steps are. Do you try naturally for a month or two, then move right into medication? And if you're not pregnant within 3 or 4 months, you should be doing IVF.
Yeah. Yeah. And the only other thing I'd add to that is that underscoring what you said about how AMH is such a like sort of misunderstood statistic because it's just a predictor of your egg reserve, the number, not the quality. So I'll say for my example, whether this is helpful or not, hopefully it is, I seem to have a higher AMH, but my quality seems to be very poor because it's very, very difficult for me to make an embryo or to get pregnant. And so to your point, it really isn't an indicator of whether you're going to get pregnant or not. So that's some optimism for you there. Okay, let's move on. Are there any studies indicating that positive thinking and removing everyday mental stresses will result in more successful pregnancies and births? If not studies, what about experiences? I'll quickly jump in because I've done a lot of research here, and then I'd love to hear what Clara and Dr. Mukherjee have to say. Now, I don't like to say that there's definitive evidence that stress is going to make you infertile. It's just not true. And we know there are people in, war-ridden cities around the world who are conceiving. That said, of course, health, optimism, gratitude, all sorts of things that you would associate with positive outcomes are real. And there is some research to suggest that things like mindfulness, things like community can help result in higher live birth rates. Now, this hasn't been studied on millions and millions of people, but it's what I say is evidence informed, right? While there are a couple of randomized control trials, there aren't thousands. It's in a way common sense that when you feel better, right, things are going to come together better for you. So it's a little bit of a roundabout answer, but anything you want to add, Dr. Mukherjee or Clara?
I don't know how we
Your
could,
turn.
I think it's hard because you can't really quantify stress like on like
Not measure it.
or a graph. You can't say that like your level of stress is this high, so you're not going to get pregnant. There's no real way to quantify that data. I think obviously putting your best foot forward, being as healthy as possible, taking supplements, eating right, all of these things are helpful, but everyone that comes into this building is stressed out. Like, let's be honest. Nobody wants to be here. Nobody's happy to be here until they're pregnant. So I think that it's a hard thing to really quantify, but just gotta do your best.
Yes, yes. And try to feel your best if you can, right? Create the tools that will help or seek out the tools that will help you feel
Yeah.
your best.
Well, I think that's the important thing to keep in mind. I think high stress levels keep, physiologically speaking, as long as you're ovulating and you're not losing weight, I mean, stress is a secondary consideration, but it's an important secondary consideration because maybe because you're stressed, you lose an opportunity to, I don't know, maybe have intercourse, or maybe you're setting the vibe with your partner that, you're setting the vibe that this is all that we are. If this doesn't happen, we're nothing. And that just completely throws everything out of kilter. And again, that stress in that aspect, it can be damaging to relationships. And I think that's awful.
Yeah, I totally agree. Totally echo that sentiment. The next person asked where the offices are in New York City, which you have five, including Brooklyn. Am I right?
Yes, we have Madison, West Side, Soho, Brooklyn, and then
Well, we have Westchester
Westchester and Long
In
Island. We have like our
and
Westchester.
Long
Lakeville
Island,
and Long
right?
Island.
Long Island, yeah. Awesome. Lots of locations. And they also asked, do you offer mini IVF?
Well, mini IVF, that's a great point. So,
Yeah.
what is mini IVF? Now, what you want to do is create a protocol to match the expected response. If I do an ultrasound and I see that you can really only make 3, 4, or 5 eggs, I don't think it's a great idea to give you the same protocol as somebody who's going to make 20 eggs, right? Because you're overloading those eggs. So I don't want to say mini IVF, I want to say personalized IVF. You should use just enough medication to get the job done. Just like saying everybody needs a lot of medication, I think it's just as naive to say mini IVF for everybody because it doesn't always work. You need to get an idea of what ballpark you're playing in and how to address that given batting situation. In other words, I'm not going to hit a home run. I need to just get on first base, get a good egg, get a good embryo, and play the game right. That's my opinion on mini IVF. It's suitable. It's important to understand the dosing requirements. You don't want to give people too much medication at all. You want to give them the right dose of medication.
Yeah. Yeah. Again, it comes back to personalization, right? It's like treating the patient and not the least common denominator. Someone asked, do you guys partner with mental health providers, social workers, or counselors for patients who may need extra support? And I know you do, but please jump in.
Yeah, so we have a social worker on staff, Rena. Our third party team has Georgia Whitkin, who's a psychiatrist, and then we also, partner with you guys and Conceive with the coaches and therapists. So yeah, we have a wide network of people we refer out to that's really complimentary for anyone that's in treatment with us.
Yeah. You guys take it very seriously and recognize this holistic piece. I think you've done it for a very long time. So, someone asked they had a stillbirth at 30 weeks. First of all, I'm so sorry.
So sorry. Yeah.
Yeah. How long would you recommend waiting until trying another frozen embryo transfer? And what steps can she take to ensure her uterus is in top shape and recovered for the next transfer?
Oh, those are great questions. I'm sorry to hear about that. 30 weeks, you want to wait at least 6 months. Okay. At 6 months, to make sure the uterus is in good shape, you have an ultrasound. You do a saline to make sure the inside of the uterus looks nice and healthy. See about maybe the first couple of periods that may have occurred in that period of time. Um, and then just go back to the basics, see how they feel. This is where the mind and body comes in because your uterus could be ready, but you couldn't be ready. And then we're just going to have you eat properly and maybe take a step back and, just watch your diet. Exercise is always great for that. Uh, Again, moderation in lifestyle, caffeine, alcohol. I don't ask you to stop, just moderate. And then when you're ready for it, we'll be ready for a transfer and get you going. But the first thing is, that is a huge shock. That's probably one of the worst things that you can go through. So it may take a little bit of time for your mind to catch up with your body. And we want to make sure that that's done properly.
Yeah, we're holding space for you and sending you a lot of love. We've had a lot of members experience that, unfortunately, and so we've got a dream team here. Um, I'm just so sorry. There are no words. Okay, we have a couple other questions, but we're really hitting up on time. Someone asked if you hold support groups or meetups where other women can meet. We do at Conceive, helping RMA patients. So if you're an RMA patient, you are eligible to sign up and we can connect you with people who are going through a similar journey. So whether it's surrogacy, donor egg, donor sperm, IVF, IUI, just getting started, all the things, preservation. But with that, there is a pretty detailed question I don't think we'll have time for. So I would maybe encourage this person, Rebecca, to reach out directly and we can help get you an answer. I'm happy to help there because I think this is a specific case. But in the interest of time, I just want to wrap up with some of the insights that we covered. I think first and foremost, like the emotional load doesn't follow the treatment calendar, right? These two things are very interwoven, but they're not always like at the same time. And so give yourself space, find the tools and support systems that are going to help you get through it. And remember, you are a whole person and don't try not to lose yourself to this. I think support is not a bonus, it's a treatment strategy, right? We've talked a lot about that, right? It's not just about, it's not a nice to have, it's kind of a need to have. So please prioritize yourself. I know some of those things sound so flippant, but we did talk about tactical ways to do that today. And you don't have to do it alone. I think many people think asking for help means you're not like strong enough to do it. You're toughing it out alone. But I think in reality, building a support team is a strength, and it's a move that helps you establish um, a foundation upon which to build to really get through it. And, if you're tuning in and you're just getting started, this is not all doom and gloom. I think this is just, looking at the holistic components. And I think it's actually just really important, right? How you eat affects how you sleep, affects how you move. All of these things about us are so intertwined, and the emotional piece too. I highly encourage anyone who joined us today, who's not already a patient of RMA of New York, to book a consultation with this dream team here. They're the best in class at what they do, and you already got a taste of that by just tuning in today. And of course, as a bonus, you will get Conceive 24/7 texting with nurses and coaches. We will help reinforce your care and will help provide emotional support as well. Any last thoughts that I did not mention, Clara, Dr. Mukherjee, as we wrap up tonight?
Well, I mean, it's reassuring. I mean, I started doing this, so I don't even want to say, but the treatment options that we have available now are truly staggering compared to, the early 90s when I did start doing this. I think fertility's come a long way. Our success rates are, and more importantly, not only our success rates getting people pregnant, but healthier pregnancies on the back end. We've done I'm very proud of the field. It's come a long way, and I think that patients should enjoy the benefits of modern fertility treatments. We're more successful than ever.
Yeah. Anything,
Yeah, to
anything else, Clara?
piggyback on that, even just like, it not being so taboo and people taking advantage of everything that, the field has to offer, and egg freezing, and, it has come a long way. So it's enlightening.
Yeah, so much good stuff happening. I'm really grateful to the two of you for joining. Huge thank you for sharing your expertise, your wisdom, and just your general like charisma and approach to this. I think it's so wonderful to see. And I'm sure anyone who's not already a patient will sign up for a consult.
Oh, thank you, Lauren. Clara carries the team. It's all Clara. Thank you for that.
Sign up for a consult with Clara, and you'll get Dr.
Pretty
Mukherjee.
much, yeah.
And we hope this helps you feel a bit more prepared and supported. Thank you for joining us.
Thank you.
Take care.
Thank you. Have a good night.
Bye now.
Bye.
Thanks, everybody.
All right.